and welcome to our show Health and Wellness, Myths versus Facts. I'm Gargi Rawat. The definition of health goes way beyond the absence of disease. The pandemic has sharpened the focus on not just physical health but also on mental health and overall well-being. Awareness of health issues among the community is a vital tool for combating health issues. Early detection in most cases improves the overall outcomes. Now, the absence of inaccessibility or inaccuracy of information about chronic conditions causes many myths and fears which inhibit early diagnosis and treatment. The COVID pandemic has taught us many lessons. Diabetes and heart disease have shown a two-way association with COVID. People with chronic conditions are more susceptible to many infections. Also, infections affect people with chronic diseases adversely. Diabetes and heart disease are also associated with other comorbid conditions. So let's get the right information and knowledge about these conditions with the help of our experts. Joining us on the show today, we're joined by Dr. Anish Behl, endocrinologist, Apollo BGS Hospitals, Mysore, and Dr. B. Vamsi Krishna, interventional cardiologist, Riddhi Heart and Skin Care, Anantapur. Thank you so much, doctors, for taking your time out and joining us on the program to answer all the questions. Dr. Behl, first to you, there was a wave of mucormycosis infections, what we in the media popularly called as a black fungus. This was during the second wave of the COVID pandemic. Many people with diabetes were affected by this. What other fungal infections are common in people with diabetes and how can they prevent them?
Though we have been hearing a lot about mucormycosis over the last 1 year during this COVID-19 pandemic, but it's not such a common infection. What we commonly see in practice is fungal infections like the candidal or the yeast infection involving the mucosal areas like the mouth or the genital region. There is another type of infection called the tinea infection, which is commonly called ringworm, again seen in patients who have uncontrolled diabetes. Now, these infections usually occur in patients who have poorly controlled diabetes and more commonly in females. Certain measures can be taken by patients which can reduce the risk of this infection. The most important one would be to control your blood sugars well. Then certain general measures like taking care of your skin, keeping it dry and clean, maintaining good genital hygiene, keeping your mouth clean. This is especially true for patients who use dentures. If they make a little effort to keep their dentures clean, all these things can make a lot of difference as far as reducing the risk of infection is concerned.
And why is it that it affected people with diabetes more? Yes, you spoke about sugar, but if you could just explain that a little more.
See, usually what happens is that any patient who has diabetes, if their blood glucose or blood sugar crosses a certain threshold level, let's say if it goes beyond 250 or 300 milligram per deciliter, there is some degree of immune dysfunction. What it means is that your body's ability to fight infection comes down. And that is the reason why patients with diabetes tend to have more prevalence of all kinds of infection.
All right. Now, let's talk about heart health. And Dr. Krishna, as we all know that COVID has not just worsened cardiac conditions in people with pre-existing heart ailments, but it also affected people without any history of a previous heart disease. So why is this so? And what other infections can adversely affect the heart?
This is an interesting question. See what happens, COVID infection is a state of vasculitis where COVID infects our vessels, not only small vessels but also medium and large sized vessels. When it comes to heart, people not only who have got previous cardiac abnormalities but also patients who were physically fit and who had no cardiac abnormalities who are affected with COVID had cardiac problems. Means maybe so many patients, these patients might have had subclinical vasculitis or pre-existing cardiac disease that has not expressed itself before COVID infection. Maybe COVID infection would have played up these abnormalities, and also so patients might have got some cardiac abnormalities like coronary artery disease and myocardial infarction due to COVID infections. Especially COVID infections in people with immunosuppressive state, diabetes, hypertension, smoking, alcoholism, that is uncontrolled alcoholism, lipid abnormalities, and those patients who have got family of coronary artery disease were more affected, were prone to cardiac abnormalities, COVID infections, rather than patients who had no cardiac abnormalities, no risk factor.
All right. Now, Dr. Behl, are people with diabetes at high risk for the flu as well? You know, thanks to COVID, there's been so much focus on diabetes as well. Are flu shots then effective and safe for people with diabetes?
Yes, patients with diabetes do have high risk of flu. In fact, any chronic medical illness, it could be a heart disease or lung disease, or for that matter, even patients who are elderly can have high risk of flu. Normally what happens in flu is that there is involvement of the nose, throat and the lungs. This tends to be seasonal in nature. Sometimes some of these patients can land up with serious complications requiring hospitalization, and some of them can be life-threatening also. Flu shots definitely give I would say, some degree of protection, especially the severity of illness comes down. There is reduction in the need for hospitalization. What we need to understand is that the flu strains that cause infection in a particular season tends to change from year to year. WHO makes an effort to identify these strains, and then this information is used to prepare vaccine for that particular season. So whenever these vaccine shots are made available, it's a good idea for patients with diabetes to take these shots, because what happens is that these shots, which are against the strains which are working on that particular year or that season, will give some degree of protection. And normally it's advocated that these vaccine shots are taken at least once a year, because they give you protection for about 8 to 10 months.
All right, Dr. Krishna, angioplasty is a blessing for people with a coronary artery disease, but can heart stents cause infection, and do people need to take extra care to avoid infection during the procedure?
Yes, sir. Definitely, angioplasty procedure is a life-saving procedure. We keep saving so many patients daily in and out. But if the procedure is carried out in an aseptic with 100% aseptic precautions, infection of stents is very, very rare. See, I will show you this. These are, I think these are all visible. These are the coronary arteries where we put stents in when the patient have heart attack. But usually these don't get affected. But what gets infected is the chambers inside. If you open the heart, there are chambers inside. So as the blood flows from one chamber to another, where there is pressure difference, normally they don't get infected. But when there is some turbulence of flow due to valve diseases, or there is stenosis, or there is stasis of blood due to whenever their patient have got some conduction abnormalities like atrial fibrillation, where the heart fibrillates like this instead of contracting like this, the blood stays in the heart without moving. So in that state, usually blood gets infected, blood gets clotted, then it gets infected, leading to conditions like infective endocarditis. And the second thing is that this muscle can also get infected. So this is called myocarditis. But usually, if the stenting procedure is carried out in an aseptic precautions, stent infection is very rare. We have rarely seen stents getting infected.
All right, so that's quite reassuring to know, because as we all know, stent procedures are so common these days. Dr. Behl, diabetes is the most common endocrine disorder. Many comorbid conditions can be associated with diabetes. If you could, share with us what other endocrine conditions are common with diabetes.
Yes, there are lots of endocrine disorders which tend to occur with diabetes. In fact, some of them predispose to diabetes. There are two disorders which I would like to talk a little more in detail, which are very, very common and we see them day in, day out. One of them is the thyroid disorder. Diabetes and thyroid tends to coexist in patients with, in a same patient. One reason for this is that both these conditions are very common. In fact, they affect close to 10 to 12% of the general population. the possibility of having diabetes and thyroid in the same patient is very high. There is another type of diabetes called the type 1 diabetes, which is also called the juvenile diabetes. Now, these patients are also at very high risk of getting thyroid disorders because both these conditions are autoimmune in nature. When a patient of diabetes gets a thyroid disorder, there tends to be some degree of affection of the glycemic control, and it needs to be managed appropriately by a doctor. There's another condition called PCOS, which is seen in women of reproductive age group. Almost 5 to 10% of females in that age group are at risk of getting PCOS. The problem with PCOS is that they have a very high risk of getting diabetes in future, which can be almost 3 to 4 times higher. Now, a patient who has PCOS can make an effort to reduce this risk by keeping their weight in check. This can be done by following a regular exercise schedule or also keeping a watch on what they eat. Avoiding certain calorie dense food and regular exercise can keep their weight in check and reduce the risk of diabetes in the future.
All right, doctors. Well, we'll just slip into a short break now. We have lots more questions ahead for you on the issue of diabetes, health and heart health as well. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about managing our health and diabetes and heart conditions. Dr. Krishna, what are the most common comorbid conditions associated with cardiovascular diseases such as coronary artery disease or heart failure?
Yes, there are two types of risk factors, like non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors include age, family history of coronary artery disease, ethnicity, where Asian people are more coronary artery disease and heart failures, hyperlipidemias, congenital hyperlipidemias, where we see high cholesterol levels in patients. Modifiable risk factors include smoking, uncontrolled alcoholism, diabetes, hypertension, sedentary life, obesity. So we should have to maintain ideal body weight with the body mass index less than 25. Above 30 is obesity. And other risk factors are there, which include like connective tissue disorders like systemic lupus erythematosus, rheumatoid arthritis, non-alcoholic fatty liver, and vitamin D deficiency. Especially in Asian people, vitamin D deficiency is very common. It is said almost 90% of Indians are vitamin D deficient. So these are the risk factors for coronary artery disease, but among these, diabetes, hypertension, smoking, alcoholism stand first.
And why is it we're seeing it in, relatively younger people these days, especially post-COVID? There's been a lot of, news about heart attacks or heart arrest among much younger people.
Yes, we have seen so many patients post-COVID with not only coronary artery disease like heart attack, heart failure, but also with pulmonary embolism, where blood clots in pulmonary arteries which comes from heart and go to heart, and also blood getting clotted in peripheral vasculature like lower limbs, causing gangrene, and also deep vein thrombosis, where blood vessels that take back the blood to heart are clotted and blocked. Usually these are seen in patients with severe COVID infections and also patients with diabetes and hypertension. Some young patients, so many patients, young patients, what we have seen is that they have a history of smoking and uncontrolled alcoholism, which has caused severe cardiac diseases in patients with post-COVID status. And also patients who have got family history, like family history, you say when father or mother has got heart attack below 55 years. So anyone, if he has heart attack less than 55 years, means the next children are more prone to cardiac diseases.
All right. Now, Dr. Behl, diabetic foot is a common and serious complication. Who can get this diabetic foot ulcer and how can it be prevented?
Yes, diabetic foot ulcers tend to occur in patients who have long-standing diabetes. There are a number of reasons for this. One is that, over a period of time, patients tend to develop nerve damage, especially in the feet, because of which they have decreased sensation. So if they happen to get a cut or a small injury, they tend to neglect it, and that can become a serious problem. The second problem is involvement of blood vessels, again in long-standing diabetes, over a period of time, because of which there can be a reduction in blood flow to a certain areas of the feet that can hinder healing of the infection. Plus, if a patient has uncontrolled diabetes, that itself can cause, as I said, immune dysfunction and increase the risk of infection. Yes, diabetics can take certain measures to reduce the risk of getting these ulceration. The first one would be to keep their blood sugars under good control. The second one would be, if they're a smoker, they need to stop smoking. And there are certain measures which are very foot specific. For example, we ask patients not to walk barefoot even within their home. If they have to wear shoes, it's always a good idea to buy a shoes which fits snugly, not very tightly. They should always inspect the foot before putting them on. They should inspect the shoe before putting them on. It's a very good idea to use a socks which is changed on a daily basis. Again, it should not be very tight fitting. And when they have to cut their nails, they should be careful. They should cut straight across and avoid cutting the skin around the nails. There's one more thing which should be done by all diabetics on a daily basis. That is inspecting their foot or both their feet. What they should do is they should look for any cuts, any nicks, any blisters, swelling in the feet, even between the toes at the bottom of the feet, because these are the things which tend to get neglected. At times, patient may not be able to do this on their own. They can take help of their relatives or their friends, but it should be done on a regular basis. These few measures can make a lot of difference and can significantly reduce the risk of diabetic foot ulceration in all diabetic patients.
All right. And Dr. Krishna, a healthy lifestyle is key to managing all lifestyle disorders. You spoke earlier as well, and about smoking and drinking, and Dr. Behl has spoken about it as well. Can a good diet and regular exercise help people with heart disease to stay away from infections?
Yes, definitely. Healthy lifestyle matters a lot because a good diet is not only good, but we should also have a balanced diet. Balanced diet is the one which contains a variety of foods in such quantities that the proportions of energy, proteins, vitamins, minerals, fats is adequately met in required quantities. Like these days we are seeing so many patients like software engineers and all people coming to our OPDs with obesity, with in these patients lifestyle and lifestyle modifications and regular exercise helps a lot, because regular exercise means it includes 30 to 35 minutes of regular aerobic physical exercises at 5 sessions per week. And also when it comes to food, normal 30 to 40 year aged person requires around 2000 calories, and a very active person may need up to 3000 calories. And we should have to avoid foods that give empty calories, like vanaspati, processed meat, energy drinks, sodas. Empty calories means they give only calories, but no nutrients. So by avoiding the foods which give empty calories, and by taking good amounts of fresh fruits, vegetables, whole grains, nuts, legumes, the diet may be complete.
All right. Well, on that note, we're at the end of the show. But yes, lead a healthy lifestyle and follow a healthy diet. Thank you so much, doctors, for taking time out and answering all our questions. Thank you all for watching at home. Goodbye.